Hi, everybody. I'm Brittany Lewis, a breaking news reporter here at Forbes. Joining me now is Congressman Greg Murphy. Congressman, thank you so much for joining me.
Thank you for having me.
Congressman, I'm really grateful for your medical expertise today because President Biden announced over the weekend that he was diagnosed with prostate cancer, and I would love to get your perspective as a urologist who has treated prostate cancer patients before and for decades in the past. I want to read some details from the statement announcing the diagnosis. First, they said that the cancer is characterized by a Gleason score of 9, grade group 5. They also said that it has metastasized to the bone. They said it's a more aggressive type of the disease, but it appears to be hormone sensitive. So first, to start off the conversation, can you break down this statement in layman's terms? What exactly does this diagnosis mean?
Yeah, so Brittany, prostate cancer is a very common diagnosis in men, especially older men. In fact, 1 in 8 will be diagnosed with prostate cancer in their lifetime. The good news is that most men don't die with prostate cancer. And so what's happened with his specific diagnosis is that it has been determined that the cancer of origin was from the prostate gland and that the prostate cancer has then spread to the bone. That's a very common thing. If cancer comes from the prostate, it's going to spread anywhere. It will go to the bone. How this all happened, I think there's a lot of conjecture. Diagnosis of prostate cancer, or the suspicion, comes from a blood test called PSA, which stands for prostate-specific antigen, which is a chemical that is made in normal prostate cells. They're normal levels, they're abnormal levels, and generally with prostate cancer itself, the level is abnormal because the prostate cancer cells, while they are originally prostate cells, tend to leak this chemical, so that causes the blood level to rise. The other part, which is critical, is the physical examination and doing a prostate examination, a rectal examination, to make sure that you don't have any abnormalities. If you're able to detect cancer early, it's usually on the basis that the PSA is elevated with a normal prostate examination. Reports are that the president was having symptoms, and generally symptoms either can be difficulty urinating, blood in the urine, or possibly bone pain. And this led the physician to check a PSA, to check a prostate examination, and by report, he found a nodule. And I guess that's where they did then a biopsy to get tissue to look at under the microscope to determine whether it's whether something was wrong, whether it was cancer within the prostate itself. And then after that was determined, to do a radiographic X-ray analysis to see what stage the prostate cancer was in.
There was a doctor on MSNBC yesterday on Morning Joe, Dr. Ezekiel Emanuel, and he said that based on what he saw, based on what he believed here from what President Biden's statement said, is that President Biden could have had cancer while he was in office. Is that what you think? I mean, could that have been the case here? And how would that not have been detected?
It definitely was the case because this cancer didn't just pop up since January of this past year. You know, we see a lot of patients with kidney cancers, and we find them because somebody came into the emergency department maybe with a appendiceal pain or something, and a CT scan shows maybe a large mass in the kidney. Well, that mass just didn't appear overnight. The cancer grows slowly. But if you're not looking to detect it, you won't know that it's there. It could have very well been there for 5 or 8 years, but it would not have spread at that point in time. And so, you know, this goes back to one of the issues, something called screening, PSA screening. There's been a lot of debate about whether you should screen or not screen for prostate cancer. I'm very much a pro screener because I've seen so many men that I've diagnosed, that I've treated, done surgery or whatever on, and hopefully saved their lives. But apparently, and this is just by a report, that the White House didn't feel a screening for prostate cancer was necessary. I don't normally do it in individuals starting over 75-year-olds unless there are symptoms, because generally their life expectancy may not be 10 years. That's where we look for a screening benefit. But in someone who's the president of the United States and, you know, looking to another 4 years of serving this country, I find it very hard to believe that the physician or the White House did not direct not only a blood test, a PSA test, which needs to be done in elderly men if they're going to live 10 years, as well as a rectal examination. So this is where it was found. But the cancer was there. It was not probably not diagnosed.
You tweeted about the PSA. You said, yes, I don't normally screen for prostate cancer after 75, but not checking a PSA on someone running for the highest office in the land is a complete travesty, medical and professional malpractice. What went wrong here then, do you think, that this is medical and professional malpractice?
Well, Medical and professional being two different things. Number one is, again, an 82-year-old in the absence of symptoms, either being difficult urinating or bone pain, you really wouldn't normally check a PSA. But in the framework that somebody is running for the presidency of the United States, when you're trying to show the nation that he is fit and able to do his job, especially in the light of this whole controversy of his cognitive decline, I think it was imperative that physician recommended that test be ordered. Now remember, we as physicians can't tell or shouldn't be telling patients what to do. We can recommend this blood test. We can recommend a rectal examination. Did he do that? Did that physician do that? Or did maybe President Biden decline it and say, no, I don't need that? I think those are questions. I can't answer those. I wasn't in the room when the doctor was talking with the president at the time, former president. So really knowing those answers really is going to be key to really figuring out, was this really the right thing that happened?
I want to talk about the timing of this because that has been a question over the past 48 hours since the diagnosis came to light. The news has come when the audio of the Her tapes has come out. Also, explosive reporting on President Biden's mental acuity while he was in office is making headlines. David Axelrod said that conversations regarding President Biden's cognitive abilities and mental acuity while he was in office should be set aside for now in light of this diagnosis. What's your reaction to that argument?
I think that's ridiculous. I mean, us talking about it or not talking about it isn't going to change anything about the way the former president's being treated. Look, this is a medical diagnosis. He's going to be, I'm assuming former President Biden's going to be talking with oncology doctors or his urologist, one for that matter. Apparently, he's already started some hormone shots, which help relieve the male body of testosterone. Once testosterone is gone, a lot of cancer cells need that to survive and they just die. And so, his treatment's not going to be changed about this, but what goes back is to the relevance is why would anybody in America trust the Biden administration, or honestly, a lot of the Democrats for that matter, and mainstream media, who said that the president's acuity was okay. I hate that people are now saying that this was covered up and hidden, the prostate cancer diagnosis was covered up and hidden. It probably was not, but the fact that there is conjecture and there's all sudden reasons to believe that his cognitive ability was definitely covered up just puts a further cloud on really the administration and those who hid the mental cognitive decline of the president from the American people.
I think what you're saying, and correct me if I'm wrong, Vice President J.D. Vance shared something similar. He said, he is feeling for the former president. He's thinking about him and his family. He also then followed up with this. Whether the right time to have this conversation is now or at some point in the future, we really do need to be honest about whether the former president was capable of doing the job. Do you still think we need to have that conversation, and is now the right time in a few weeks? I mean, what does that look like?
No, I don't think there's any reason to not have that conversation now. It doesn't dim anything about President Biden's treatment or what he's going through whatsoever. Let's just say we take the cancer diagnosis out. We're talking about it. The conversation is about his mental decline and the fact that this was hidden by the American people, by his wife of all people, by his family, by his staff members, all of these things going on. So adding this other fuel to the fire, I don't think it changes the conversation to question, why did they lie so much to the American people?
And right when this news came out, President Trump released a statement saying that he and his wife, First Lady Melania Trump, are thinking about the Bidens. President Trump suggested, though, after that yesterday, that somebody is not telling the facts here. But what you're saying is, as a doctor, based on your expertise, you don't believe that the prostate cancer diagnosis was covered up, although you have questions separately about President Biden's mental acuity while in office.
Well, I just can't say that it was covered up. There's no indication. The only way I would know if it was covered up or not is to know when the prostate biopsy was done. When was the determination of cancer done? It very well could have been just 5 or 6 weeks ago. Maybe he had some hip pain, and then finally somebody did a PSA and a prostate examination on him. That may very well be plausible, and that very well could have happened. Or it could have happened, a year or two ago, and he's been on blood tests. He's been on hormone treatments, and something else happened. Again, I'd like to know when the biopsy was done, when the bone scan showed the metastatic disease. That would give us the truthful answer about the entire thing.
And you posted that on social media. That's your main question. When was the biopsy done? That will give us the information that we need. Do you think because President Biden is no longer president anymore, he's not serving in public office, do you think we will get that information? And do you think the American people deserve that information?
I don't know that we would get that. I'd love for the President Biden to come out and say, this is when my biopsy was done, it would allay all the suspicions. There wouldn't be any of the conspiracy theories going on. But this administration, good Lord, I think even the press correspondent for Jill Biden talked about the lack of transparency from that administration. Why would he not just put that information out and say, look, this is when it was done. Let's actually just give a show of some transparency from that administration.
Do you have any other questions about this situation, about the Biden administration and this type of diagnosis?
Well, his diagnosis and his treatment, he's in his personal life right now. I don't have any questions about that. Hopefully he surrounded himself with very good and competent doctors. I'd like to know, number one, when's the biopsy's done? And number two, why wasn't this evaluated further when he was running for the presidency of the United States? I think that's a real blemish across the administration and possibly the White House doctors. Why weren't they giving a full, unabridged account of the president's health for the American people? Moving forward, President Trump went through a full physical. Everything was determined to be okay. I think the American people need to have trust. They need to have reliability in a responsible report about the man who's going to be leading the country moving forward. There's just so much distrust now because of the lack of transparency from the last administration. I think this would be a step forward to try to push transparency again if we knew some more facts about what the former president's diagnosis, when it happened, and what prompted its investigation.
And do you think those doctors who were doing the physical and the tests on President Biden while he was president, do you think they need to answer any questions right now?
Well, I think it's also a question within medicine itself. I think there are physicians who are derelict in their duty that are not doing prostate examinations. That's really a medical question. So the real question is, did the doctor offer the test? If he did the president refuse? If he did not offer it, why did he not offer it? Especially really in light, again, I went back and say I don't normally do this over 75 in the absence of symptoms. If he didn't, why didn't he? So, I think those are fair questions and they should be answered.
Congressman, I appreciate your time today. Thank you so much for joining me. You're welcome back anytime.
Thank you.